Welcome back to my videos on dementia. Today we're talking about the days, weeks and the first few months after a dementia diagnosis. If you're here because you've just had a diagnosis or you're supporting someone who has, you're in the right place. By the end of this video, you'll know what matters now, what can wait, and what you don't need to worry about until later. As you hear the diagnosis and in the hours, days, and sometimes the weeks that follow, there's often an emotional dip and it can be unexpected. Most couples and family think they're the only ones that feel this way. You're not. Almost every newly diagnosed family member goes through some form of emotional crash. Shock, grief, self-pity, depression, it's all normal. You're not weak, you're not failing, you're simply reacting like any human being does to life-changing news. So you may leave the clinic with a stack of leaflets, or you might be handed them when a nurse visits your home a few days after the diagnosis meeting. Leaflets can be overwhelming. Some of it is useful, but much of it can wait until you're steadier. Don't try to read everything. Pick one or two things that feel relevant. So soon after diagnosis, you will get a call or a visit from a nurse about medication. There are 4 drugs that might slow progression for some people. They're not cures. They don't work for everyone. Each have side effects. Saying yes to one of the drugs is fine. Saying no to all of them is also fine. You can revisit the decision at any time. You're also allowed to ask for time to think. You're allowed to ask questions. You're allowed to change your mind. Around the country, support varies. Every area of the UK is different. Some services are excellent, some are stretched thin. In some areas, people appear never to make contact. Have a look at the screen and you can tell what quality you've got. But how much support you need is also personal. There's no right amount. And services vary by geography because the resources they have vary. You can start to build support for yourselves. Some of the best support you'll ever receive won't actually come from the NHS. It might come from other carers, from your community, your faith groups, from volunteers in your community, from people who understand. Many carers I've met say peer support was the turning point for them, the moment they stopped feeling alone. So let's talk about the essentials, the things that really do matter in the first few months. Lasting power of attorney, wills, applying for benefits, a blue badge, council tax reduction, and so on. Some of these need to be thought of before your loved one loses the ability to state their preferences and perhaps lose their ability to sign their name. These documents will protect your loved one's wishes and prevent crises later. You might also want to start recording changes in their behaviour. Write them down with date, time, frequency and intensity. You might also want to make short videos of their behaviour, and that could help you communicate what's going on especially at the start when you don't have the vocabulary. Next, we should look at things that will help you that you really should do, but you don't need to be perfect. So perhaps start to create a daily rhythm. Flexible, not rigid. It will change and often. If you can, connect with at least one peer group or online forum. Reaching out to family is a good idea, but only if it feels right. And finding one or more professional who knows your situation, who you trust, maybe your GP. So on to the things you could do. Useful but not urgent. Take them at your own pace. Start to self-educate. Look online, use YouTube, but filter what you see. Not everything's right, and not everything's about how things work in this country. As I've said, sometimes local groups are run by people on a mission, people for some reason who want to help those with dementia. You could look around your house and see, does it suit someone who's losing their ability to move as well as they used to? So there are things you won't need to do right now. No criticism. It's just they don't need to be done. They can wait. You don't need to know what every stage of dementia looks like right now. You don't need to buy some equipment that's not needed until later. Give yourself permission to focus on the now, and your future self will handle future challenges because you'll be more prepared and confident. So summarizing, if you remember nothing else from this video, remember this. There are a few things to do now and a lot of things to do later. Whilst many carers do try to do everything all at once, you don't need to. Focus on what immediately is needed, and then focus on making the journey of your loved one with dementia as comfortable and dignified as possible. You will be proud you did so. Thank you for listening. The ideas in this video are mine, born of personal experience. If they do help you, great. If they don't, perhaps they'll prompt you to move closer to your own ideas for what suits you and your loved one with dementia. And of course, I recognise that each person's formal diagnosis might come at a different stage of dementia. Whilst most people I've met are diagnosed at fast stage 4, some are diagnosed later, and some with mixed or rare dementias will need an emphasis placed on actions that suit their personal situation and their health circumstance. If this video has proved useful, please pass it on to the next person you meet who is newly diagnosed.